Probably let me know.
All right, everybody, this is a little video demonstration of us scanning our neck levels. I hope that this helps, and if you have any questions, you can send them later.
All right. So first, usually we divide the neck into right and left. When it comes to zone 1, you can get away with doing just like a midline shot, especially on kids probably. But if it's more of like a bigger kid or something, I will sometimes still divide it into like right zone 1 or left zone 1. So zone 1, like I said, it can just either be midline, but it's going to be right underneath the chin, kind of like a submental.
Cindy, take your mask off so you don't get jelly on it.
Yeah.
I didn't know. It's wrong the camera. Let me up this time.
Stop it.
Yeah. So basically what you're going to want to see is kind of that submental area, and you're really not going to typically see a bunch of enlarged lymph nodes here very commonly.
So Jenny, let me ask you this. You always start and do it the same way every time?
I do.
You start with 1, and then do you go right or left next?
I usually do all of my rights,
Okay.
and I usually go in number order 1, 2, 3, 4, 5, and 6.
Okay,
And then I'll switch to the left.
okay.
And a lot of times what I will do, depending on how easy the patient is, sometimes I will go ahead and skip, like I'll do my thyroid and then I'll do the right neck levels before I switch to the left if they're like kind of iffy about getting the gel on them, and you know, if they're a little nervous, I just try to keep my probe in like the same
Spot for a while.
before I switch and give them a break. So if I'm doing a thyroid, I'll do all my thyroid stuff and then move on to the next. So like I said, I usually start with zone 1 here and just kind of go all the way up to where you can kind of see the jaw, so you know you're up high enough, and then slide all the way down until you kind of start getting into that submandibular area, hyoid area.
So where would I take a picture of?
So if you don't see anything, you can take a picture anywhere in there.
And there's typically 2 nodes right there. One
Always?
on each, almost always. Right? There's 2 nodes that live there
Yeah,
that I can see typically.
yeah. They're usually pretty normal. It's not, zone 1 is not a common place for thyroid cancer to metastasize. But we gotta check it anyway. So after I move from zone 1, then I move into zone 2, and usually at this point I'll have them turn their head if they can just a little bit, and I come more laterally until right underneath the ear where I can kind of see the tail of the parotid gland. And I start there, and anytime I'm doing this, I scan first and take pictures second. I'm going to scan through here, investigate that the tail of the parotid, slide down until I kind of come into like the bifurcation of the carotid artery, and you're going to start seeing some of the submandibular gland. That whole section here is zone 2. And here's where you'll see some decent sized lymph nodes, but again, zone 2 is not super common to find metastases either. They can be bigger as long as they're oval and have the fatty hilum. So this is really common to see just like a little more prominent but normal appearing lymph node in that area. And again, I'm just going to scan through there. If I don't see anything that's concerning to me, I'm just going to take, just like I said, a representative picture and then move on. And then from there, we go into zone 3. So zone 3 typically starts about the bifurcation of the carotid. So when you see the carotids bifurcating, comes back together at the bulb area, that's where I do zone 3. And I always want to try to keep the carotid as far medial as possible because I want to investigate the lateral aspect of the neck here. So we don't necessarily want this carotid to be right in the center because we're missing all of this where the main lymph node chain is more to the lateral aspect. And you're just gonna scan down here. And the separation between 3 and 4 is not a specific delineation. So I always just kind of start at that bulb, that bifurcation, and I scan through until I kind of get to the like dip of the neck, supraclavicular area, and that's where zone 4 is in it. So then I'll kind of stop there and come back up. And whenever I look for lymph nodes, I do kind of try to move at a decent pace because you can kind of see them start to wink at you a little bit, as opposed to being really slow, and then you can't see them coming in and out as well. But zone 3, very high likelihood of metastases from thyroid cancer. So we want to make sure we're getting a good look in that zone. But again, if you're not seeing any, like all these teeny tiny little lymph nodes with fatty hilums, they're oval. So I'm not gonna measure any of those. I'm not gonna be worried about any of those. So I may just get 1 or 2 of them in a picture, show that I took that level, and then we'll move on to zone 4. And again, zone 4 is basically supraclavicular. So what I usually do kind of to make sure I come down to the clavicle and then work my way up. So I see I'm on that clavicle, and then sometimes you do have to push down a little bit to make sure you're getting in that groove, and you're seeing some of these vessels down here, and just kind of work my way back up through that supraclavicular area. Again, I'm keeping the vessels more to the side of the screen versus in the middle, because this area of the lateral neck is where we want to concentrate. And come back down until, boom, I'm on the clavicle right there. So then I know I've investigated the entire zone. And again, if you don't see anything, you take that picture. Sometimes just so they know that I'm there, I'll oblique a little bit so you can see the clavicle, so they know I'm down there far enough and in that zone. And then from there, go to zone 5, which is a little more posterior. So again, if they can turn their head further back, great. If not, then you just kind of, I almost bring my hand all the way back around behind them, and I usually start at the hairline, right at the base of the skull, so that way I know I'm behind the sternocleidomastoid muscle. And usually here you can bring your depth up a little bit because this is not a very deep zone, but you start up high and just kind of work your way down. Sorry.
That's all right.
Cindy, are you awake still?
Barely.
Just a little massage on this too soon. There we go. So yeah, you can see, make sure you're getting from the top all the way down until you kind of start getting into the top of the shoulder. And once I get down to where we're getting into more like a trapezoid muscle there, then you know you've scanned that whole zone 5. So this one's probably one of the bigger zones just because it's basically the whole posterior part of the neck. And this is one where if I was going to divide it into like superior, mid, inferior, this is one that sometimes I will if it's a big kid.
Okay.
With a long neck or anything like that, I might do that. But again, if not, I'm just going to scan through again at a decent pace. You don't have to be like millimeters at a time, because if something's abnormal, it's going to jump out at you. So you take that representative and then move on to zone 6. So then I usually have them just look straight up. So zone 6, if you've already done the thyroid, there's because zone 6 includes the thyroid. So if you've already done that, then essentially I'm going to go to the inferior part of the thyroid. And this again, zone 6 if you want, if it's a small kid or if you're, you know, they're not very cooperative, just do a midline and do it one time. Don't divide it into right and left. If they're cooperative, if they're a bigger kid, then again, you can kind of come inferior to the right side of the thyroid and then track it down into the sternal notch from there. That way you have it covered. But if you need to just do midline, just come to like isthmus and just track down, down, down. You do have to push a little bit in order, because you're going to run into clavicle and stuff like that.
This is zone 6?
This is zone 6.
So it's not the thyroid, it's just around the thyroid.
Zone 6 technically does include the thyroid. So this is assuming you've already done the thyroid. If they don't have a thyroid, then you're going to want to come up here and do like the thyroid bed, which like she doesn't have a thyroid on the left. So since on her side, I would probably label it, you know, like left zone 6 / thyroid bed. And I would take some extra pictures of that area. And then again, just make sure with zone 6, you're getting it all the way down into that sternal notch where you're starting to get the sternoclavicular joints, and then even angling down, pointing down into the top of the chest here.
Have you seen a lot of abnormal nodes in that area, Jenny?
Not a ton. They're very hard to see. The other thing with this is using maybe the hockey stick or a head probe to get in there, because if you do see them, they're typically just inferior to the thyroid, the inferior part of the thyroid, or they're pretty deep down in here.
Okay.
Yeah, the other tip on that is we have head probes that can do good with this.
Mm-hmm.
At Barnes, to get under those clavicles for abnormal nodes that might be down there or parathyroid, they use the transvag probe. And I just think that sounds so crazy, but it works. It gets under there and it gets way down in the chest around those vessels and stuff where things could be hiding.
Yeah.
Especially parathyroid adenomas.
Yeah. Because what you want to make sure you're in, so we're getting into like almost aortic arch here.
Yeah.
So we're into the chest already with zone 6. And then usually I'll come in, so here, this is the top of her sternum now. That's as far as I can get. And again, sometimes just I'll take a picture of it just so they know this is how far down I went, so they know where I'm at.
And then I see a lot of, on the babies, the little kids, I start seeing that thymus.
Yes.
Thymus, right?
Yes.
Thymus
That's the
come
other
in
thing.
there too, which you'll see it, but when I was new, I mistaked it for a mass.
Yeah. So yeah, so once I do all like right 1, 2, 3, 4, 5, 6, then I'll switch over and just basically repeat the same thing on the other side. If you do see something, then my biggest like suggestion is to try to, like, if there's a lymph node that you think we're gonna have to follow up, just try to include some sort of landmark. So like if I was gonna say, if I thought this right zone 2 lymph node was abnormal and I was gonna take some extra pictures and decided I want to measure that, then I'm gonna maybe take it here and label this like submandibular gland. So just for your own self and everybody else's, when there is a follow-up, there's some sort of landmark to help with the follow-up to make sure you're doing the same one when it's a follow-up. If there isn't a landmark, then just be more specific about, most of them there is. Like if I am gonna do like zone 3, I'll try to include like the mid portion of the thyroid and the carotid, so you can just, it's just a little more a little easier to
Like reproduce. Yeah, think of it this way: if you find an abnormal one, they're probably going to go for an FNA. Somebody has to refine that node.
Right.
So, and it's probably not going to be us.
Right.
So
Yeah.
try to lead them there the best that you can with words or pictures or whatever.
Yeah. And
Or
like,
we may be up there refining it if they can't. I
Exactly.
mean, I don't know. I just know that you're right, trying to find somebody else's work can be difficult sometimes.
Yeah, so if you're not finding anything abnormal, you can whip through this relatively quickly.
Yeah.
It shouldn't be something that you're like hunting and pecking for. Generally, lymph nodes, if they're abnormal, are gonna pop out at you.
Yeah.
They tend to be round, they tend to have little focuses in them, or you can't find a fatty hilum, so you're not even convinced it is a lymph node, you know?
Right.
So it's one of those things where if it's not jumping out at you, it's probably okay, you know?
Yeah. And then, you know, the other thing I want to add, a couple of something I've run into before is like, if I ran into a really bad case where the abnormal lymph nodes are just diffuse,
Right.
I will take, you could be there all day measuring every one of them, right? So I will take, I don't know what your process is, but I would kind of take a representative one of each level,
Right.
like measure and color on each level, and just let the radiologist know that there's, you know, do some cine clips through
Right.
that it's diffuse and they're everywhere, and here's one of each level, because what I've learned is that when it is like that, they'll go to the OR and they'll go take that one out, and they'll take a whole bunch of them out around it
Yeah.
to try, to just to clean it out.
Yeah.
So I guess my point is don't get in there and try to think that you have to measure every single one of them.
Yeah, kind of like a thyroid.
Yeah.
You don't
Yeah.
measure every single thyroid
Yeah.
nodule that you come upon. You know, you pick the most worrisome, the biggest, or the most representative
Yeah.
of that
Right.
section.
Yeah, microcalc, cystic spaces, abnormal shape, large size. What else?
Loss of hilum.
Loss of hilum,
Yeah.
or not just hilar flow, but if you put
Oh, yeah.
color on one and it's got little vessels coming in from every direction,
Right.
you need to be thinking about that one being abnormal too.
Yeah.
I don't think there's anything else.
Not really.
All right. I'm going to go ahead and stop this video and share it with everybody.
So we only